May is a time to recognize Asian American, Native Hawaiian, and Pacific Islander communities across the U.S.
And this morning, we're shining a light on the impact Filipino nurses are making in our local healthcare system. Here's Jolie Rodriguez with the story.
Sam, Rashawn, immigration of Filipino nurses dates back to the early 1900s when President Taft enacted the Pensignado Act, allowing Filipinos to pursue education and training in the U.S. Among them, some of the earliest Filipino nursing students who later founded 17 nursing schools in the Philippines. As of 2022, Filipino nurses make up 33% of all foreign-born RNs in the U.S. and 4% of the total nursing population. One of those is Alvin Baluyat, who says nursing is deeply rooted within the Filipino culture.
Alvin Baluyat starts his day like any other. Once the scrubs come on, it's time for breakfast. Coffee, leftover pancit, and pandesal. Probably not a typical breakfast for his neighbors, but common in Filipino households. But after taking care of his needs, he clocks in to take care of others.
It was my grandmother who was sick at the time, and I had to choose what career I should take. And I believe that caring for the sick loved ones is deeply rooted in Filipino culture.
Baluyat grew up in a multi-generational household, as many Filipino families do. So caring for others was not new to him.
I just want to take care of her in a better way, because as a child I was like, I don't know how the nebulizer works or how this oxygen works.
Working as an international nurse for the last 15 years, he made his way to the U.S. with his wife and 2 kids in 2022. In Baluyat's unit, about 13% of the nurses are Filipino.
We inspire others to be better nurses as well.
From bedside care to leadership roles, he says it's their upbringing that makes Filipinos great healthcare workers.
Every Filipino that you will find is a compassionate, dedicated, and resilient nurse. That's how they are, because that's how their experience in the Philippines mold them to become, and that's what we offer to the world.
And that dedication doesn't go unnoticed. OSF Healthcare recently launched a program to sponsor international nurses, and for Filipinos, the path to practice here is often more straightforward.
Most Filipino nurses have a bachelor's degree in nursing that is compatible to, the U.S., educational system.
Shelly Ramirez, Immigration Program Manager at OSF, adds the Department of Labor designates Schedule A occupations like nursing to be exempt from the often lengthy labor certification process that comes with employment-based sponsorship. And word travels fast.
The Filipino community is really good at both communicating and supporting one another. I was amazed at how many referrals we got so quickly.
And for Baluyat, who now helps others like him acclimate to their new life in the U.S. as a nurse, he says,
for me, nursing is not just a job. It is a calling, and I realize that this calling involves not only caring for your patients, but also caring for your colleagues.
As hospitals across the country continue to face staffing needs, Filipino nurses like Baluyat aren't just filling gaps, but rather sharing a culture of compassion that's traveled across oceans to heal. Baluyat's message to young Filipinos aspiring to go into healthcare: if you feel that you have a part of yourself to give to the world, then do it. It's not easy, but it's rewarding.